This is To the Point with Michael Williams.
Good morning and welcome to our new broadcast home for To the Point. Our topic today, COVID-19, the science, the surge, the politics. My first guest, a familiar face, Dr. David Dotson, an infectious disease specialist in Palm Beach County. And Doctor, we appreciate you being with us this day.
Michael, thank you very much, and it's always a pleasure to talk with you.
First message, parents, school starts this coming week, and a lot of parents have a lot of questions. What is your advice? The CDC has said it recommends anyone over 2 wears a mask. In the state of Florida, it is optional. The governor says he'll block any effort to mandate masks. If parents asked you, best advice?
Best advice is to think about how the virus is transmitted. It's transmitted by respiratory droplets, some airborne and some by touching surfaces. So the only ways we have to stop this is masks and social distancing and then washing the hands. So when you have a very contagious virus that you're dealing with, you have to do everything you can to limit the spread. And so my advice would be mandatory masks in all school settings above the age of 2.
That's not going to happen in the state of Florida. But what I hear you saying is you recommend parents take the option of putting their child in a mask. Am I correct?
That's correct. And other governors have recommended mandatory masking. But if it was my child, I'd put a mask on him.
Masks work.
Masks work to prevent this very contagious virus from spreading.
We'll talk about the politics of masks, but from a medical point of view, that's worth reiterating. Masks work.
Yeah, from the beginning, we learned how this virus is transmitted. It's a respiratory transmission, and the mask, the social distancing, the hand washing, that has not changed. The biology of the virus has not changed. The virus has gotten smarter, it's more transmissible, but it's still the same virus.
Another piece of news that broke late last week, Moderna says it expects boosters would be likely needed by winter. We'll have to see if that gets federal approval, how actively engaged the administration would be in terms of distribution. But do you agree that we're looking at boosters?
Yeah, I think we've all expected that. So the good news is that Pfizer and Moderna vaccines are holding up very well at 6 months, but I think as they look down the line, they start to see a little bit of waning immunity, so they're getting ready. The other question is, what's the best booster? Should it be the exact same thing that you got before, or should it be a little different? Should they tweak it, or should it be a different vaccine? They're working on that, and more to come on that, but I think everybody's going to get a booster.
Why are we here? Where are we going?
Well, in December of 2019, the coronavirus made its entry onto the world stage, and that was the beginning of a biologic war. We didn't really realize it, but it was. And so it's been humans against the virus, and the virus so far has been doing very well. 200 million cases in the world, 4.2 million deaths, and so the virus has been spreading very well. The virus is efficient, it's silent, and it's relentless. And on the other hand, we have human beings, and we're uncoordinated, we're divided, we're fatigued, and we're getting tired of all this. And so the virus,
the virus doesn't care how tired we are.
The virus doesn't care. It'll take any opportunity we give it.
How do we solve this?
Well, Michael, I could if I had a magic wand, I could end the pandemic by the end of August.
What do you mean?
What I do is I take the magic wand and reach 100% vaccination in the United States, and then I would institute a 2-week stay-at-home lockdown to interrupt current transmission. At the end of those 2 weeks, game over for the pandemic.
And to be clear, you're talking about what you would do medically. There are not going to be lockdowns, most certainly not in Florida, but you'd be thrilled if everybody got vaccinated. To you,
sure.
That's the answer.
The point is that we can beat this pandemic.
By the way, before we move on a bit of a side note, the governor of Florida, Ron DeSantis, has said he thinks this is a summertime spike that will go away. Is it a summertime spike?
Well, every respiratory virus that we've heard about before has been, the spike is in the winter when people are in enclosed environments. And that's why respiratory viruses increase in the winter. It's not July.
So from a purely medical point of view, that doesn't make sense.
That's wrong.
Let me ask you, your message then, as we segue to the unvaccinated. What is the message to people watching now said, I haven't been vaccinated, I'm not going to get vaccinated. What do you say to convince them otherwise?
Well, what we've seen is in all of 2020, all of the cases, as you watch the graph of the cases, those were all unvaccinated people because we didn't have vaccines. And then after the vaccines, the caseload in the United States went down, and now we're seeing an uptick. The uptick is all unvaccinated people. So at this point in time, since the vaccines have become widely available in the early June, say, every case and every death subsequent to that has been unnecessary. And it's a shame. And if people would just get vaccinated, at this point in time, if you're not vaccinated, if you're not part of the solution, you are the problem.
Let's run briefly through some of the arguments. One, I don't trust the vaccine, I don't trust the government.
Well, number one, vaccinations have been a standard part of United States history. We eradicated polio and smallpox. We require vaccinations for school, for the military, for colleges.
And that's worth repeating. Vaccination requirement has been with us for a long time.
It's nothing new.
Right. Or vaccines have been. We're not
right.
requiring
it's
this, obviously. But
the vaccine hesitancy is a new phenomenon, and I think reflects the internet.
We'll talk about the politics of that in our roundtable coming up. The next thing. Why get the vaccine? There are breakthrough cases. People are getting vaccinated or still getting COVID.
Well, we've learned that the vaccines prevent hospitalizations and deaths. So yes, we have learned that you can get infected if you've been vaccinated, but you're not going to end up in the hospital and you're not going to die.
One internet rumor going around, I won't be able to get pregnant if I get the vaccine.
Well, there's no biologic reason to think that injecting a piece of mRNA in your arm is going to result in infertility, and there's no evidence to date of that. And I will say that if you die of COVID vaccine, you definitely will not have any children.
And let me ask you, mRNA. People say it scares me. It's going to change my DNA, say the critics, say those who are hesitant.
That's impossible.
Say that again. It's important to know.
The mRNA that's injected into your arm, it's broken down very quickly by your body. In the meantime, your body has recognized it and developed antibodies. That piece of mRNA is gone very quickly.
Doesn't change your DNA in any way, shape, or form.
No, impossible.
Talk about vaccine inequality. That is a real issue we're dealing with, especially in underserved communities, minority communities. There's been a hesitancy. A lot of it is historical, and some of that very justifiably so. How do we break through to make sure that we're doing more for our underserved communities to break through that barrier to get more vaccinations there?
Well, first by realizing is every human being is a target for the virus. So we have to immunize every single person to prevent the spread. So we have to reach, if people are not getting it, we have to figure out ways to get in it, whether it's vaccine buses or whatever it is. We have to get everybody vaccinated.
You've had people come to you, I'm sure, who are legitimately scared, say, I'm scared of getting it. Put your doctor bedside manner on and talk to me.
Well, on one hand, we know that the vaccines are safe. There have been 4.3 billion vaccine doses given in the world so far, and nobody has had any major problems. The vaccines save lives and they save hospitalizations. So on a risk-benefit basis, it's very clear that they do benefit. The theoretic things that I'm hearing, I think it's just a bunch of BS. I really don't think that a lot of these reasons that people don't get vaccinated hold up at all.
And it is a global pandemic, and we need to do a lot more about making sure the world is vaccinated. That thought and your final thoughts.
Yeah, so we each do better when we all do better. So we need to think about, instead of thinking about our right not to get a vaccine or wear a mask, we need to think about others. What about our right, our society's right to go to a movie or go to dinner without worrying, or send our kids to school without worrying that they're going to come back with a lethal disease? And this is the exact point where we need national unity. The virus is not divided in what it's doing. We are. And we need to come together and all get vaccinated to stop the pressure, stop the pandemic. And a final thought is just for the heck of it, why don't we think about letting scientists run the pandemic instead of politicians?
And we will continue on that very cogent thought with our roundtable in just a moment. We thank you for being with us. Dr. David Dotson, infectious disease specialist here in Palm Beach County.
Thank you.
The science of COVID, giving way to the emotions and politics. You just heard it surrounding COVID. Our roundtable next.